Hello, and thank you for joining us today, Therapy Chat with Phoenix Behavioral Health. My name is Dr. Parks, and I have with me Christine DesLauriers, LICSW, and LADAC, KDAC, Substance Abuse Specialist. Today, we're going to talk about a very, very popular, common mental health issue, bipolar disorder. We've talked about a lot of other mental health disorders and personality disorders. This one is probably one of the more common ones that we do see. And bipolar disorder, meaning that we're seeing two different ends of the spectrum. We're seeing depression, but we're also seeing mania, and it's a swing between both of those. So unlike what we call unipolar or regular depression, where an individual presents with symptoms of depression and fatigue and hopelessness and low energy, etc., with bipolar, we're seeing swings to the opposite end of the spectrum, where a person will present with agitation and not feeling tired, right, and a high level of impulsiveness, etc. So that's what we're going to talk about today. We do have bipolar 1, and there's a bipolar 2. Oftentimes, clients are a little bit surprised about that. You know, it's just kind of looked at as bipolar. But there's 1 and 2, and then there's also something that's called the cyclothymic disorder, where there's a lot more frequent jumps from one state to the opposite state, so it's happening more frequently. Christine, do you see a lot of clients presenting with this, and how do you start to think about the possibility that a client may be presenting with bipolar?
Yes, it's very common, actually. And what I try to do is I try to assess the duration of the symptoms and also the onset of them, when they started. Oftentimes you will see bipolar starting in the teenage years. Very common also to be brought about in college, because there's a lot of stressors in college, and there's a lot of dysregulation of sleep, and those are things that can even later in life offset your bipolar or get it off track and have you have episodes. I also try to find out if there's patterns to it. Oftentimes you will see cycles where with a regular depression you kind of have often a steady symptoms without much interruption. They might lessen at times, but it's pretty steady. With bipolar, you'll see it triggered often by the change of light in the fall or in the spring, and you just see cycles where it'll come in and it'll either be the mania that will present or the depression, and that gives you an idea that is probably bipolar going on.
Yeah, and I think it's important, and we'll be looking at the graphic in a few minutes, but it's important too that when a person's presenting with feelings of perhaps irritability and mania, or with symptoms of depression, that is very common to just about everyone. And so it's meeting certain criteria that's important, you know. I mean, if things are not going well, if there's a lot of stresses, it's normal to feel depressed, or it's normal to feel anxious. So sometimes I'll see clients who come in and they'll say, well, I have bipolar, because perhaps they read about it somewhere, or perhaps because they're feeling really down for some valid reason. So it's very easy to see that clients assume sometimes that they may have it and they don't. Yeah. So let's look at graphic 1, which shows a little bit about the criteria. that an individual has to meet to qualify for bipolar disorder. So you see on this graphic that a person who's experienced the manic side, the mania, right, the elevated expansive mood, right, the mood must last for at least 1 week and be present most of the time, just about every day, right? There's something else called hypomania, where the person isn't as elevated as a manic episode, but they still meet certain criteria for hypomania, where the mood has to last for at least 4 days in a row, where that feeling of mania, hypomania, is present most of the time. The biggest difference because both are manic episodes, the biggest difference is the severity. So in a manic episode, a person may go out and take all of their money, all of their savings out of the bank, do things that create really big issues for them. Whereas in hypomania, a person is still elevated, but they don't go to the extent that a person would do if they were in a manic episode. So we can see on the graphic that during this period of mania, 3 or more of the following symptoms must be present. So you don't have to meet all 7. And a lot of people may say, oh yeah, I go through that, there's 1 or 2 things in there, but you would have to meet at least 3, right? So we're talking about an inflated self-esteem or grandiosity. Have you ever worked with clients who you see kind of showing that part of it?
Yes, sometimes they feel that they have special abilities and they're very important, and they can do things that normally you wouldn't see the average person doing, like they have access to the president, or they have some special communication with someone, or their writings are going to be published and they're going to win awards when they have no real experience writing. Things like that.
Second one, decreased need for sleep. And it's important to specify here that it doesn't mean that I'm not sleeping, because a lot of clients may not be sleeping well, but it doesn't mean that they don't want to sleep well. When we're talking about a manic episode, we're talking about a client who doesn't feel tired. They don't want to sleep, So when that individual is meeting with a therapist, the therapist will likely ask, are you not sleeping because you can't sleep even though you're tired, or do you just not feel tired? And typically someone who is in a manic episode will say, no, I have this amazing amount of energy. I go, and I don't want to sleep. I don't feel tired. Well, that's an important thing, though, to consider. Increased talkativeness. I know that, with some clients I have who may be going into a manic episode, you can really see that pressured speech. It's going really, really fast, racing thoughts. And again, racing thoughts on their own, a very common symptom of typical anxiety, right? Very easily distracted. I find it very hard to focus and concentrate. There's typically either an increase in setting tons of goals. All of a sudden, I have 10 goals, or I'm very physically agitated. Can't sit still, moving a lot. It's a common sign. And the last one on the list, engaging in activities that hold the potential for painful consequences, like emptying out their bank account.
Yeah, driving 90 miles an hour
Yes.
down the highway, getting pulled over by the police.
Yeah.
Sometimes it's risky sexualized behavior. And oftentimes when you are in those episodes, you will use substances to try to knock back some of the symptoms, especially if you've been awake for a few days and you're you know, in a manic episode.
Yeah.
Oftentimes you might drink to try to bring yourself down a little bit,
Yeah.
and that can lead to secondary issues with substance abuse.
Yeah. Yeah. So we have all of these that contribute to someone being in a manic episode, and remembering that an individual would have to meet at least 3 of those for that duration of time as well. Then we look at the other side, which is the depressive side of bipolar, which is defined as a major depressive episode for a period of, you know, we're seeing these symptoms for at least a period of 2 weeks. Depressive episode would mean loss of motivation, very, very low energy, feeling very sad, feeling very down. So for this, a client would have to meet 5 of these criteria, so it's quite a few more. So some of the questions that they would be asked, meeting with a therapist, would be this depressed mood, as it being most of the day, nearly every day, you know. Another key thing to think about when we're asking that question is what precipitates the mood change, right? Is it external, or is it more of an internal? Typically when things around us are not going well, and there's a lot of stress at work or in the home, it's a very normal reaction to feel upset and down and depressed. Typically in a bipolar presentation, we'd see that nothing's changed around me. It's this kind of this internal thing where I just start moving towards feeling depressed. And people who have been dealing with bipolar for a while will say, I feel like something's changed and I'm starting to go this way, nothing's happening around me, or I'm starting to feel the other way and starting to get really energized and manic. So we're looking at the source of the switch over to the depression as well. Loss of pleasure or interest in activities, especially if you know, meeting with a client who you know normally has a few things that they really enjoy doing, and now they're saying, I'm not interested in doing any of these things. Nothing's remotely interesting. What you can see as well during that time is that there's a significant weight loss, or there's not much interest in food, in eating. You know,
Excessive sleeping.
yes. With the appetite thing, and that this is a kind of a swing. And way back in one of our early sessions, we talked about, you know, how we can respond to these states. And so we're likely to see either a disinterest in food, no appetite, or the opposite, where it's just more like emotional eating that's happening. A lot of motor agitation, pacing, moving around. It's really hard to sit still for any fair amount of time. You know, I've got to be moving around. And if I'm sitting, then it's perhaps a lot of shaking, moving, that kind of thing. Loss of energy. And like you said, the sleeping. Yeah. Often you'll see feelings of either worthlessness or feelings of guilt, just feeling not good about myself. difficulty concentrating, difficulty making decisions. And you know, when I'm in my normal mood, I may be very effective and very efficient at my job, in regular interactions, but you know, moving towards this depressive side of bipolar, just simple, straightforward decisions may be more difficult and more challenging.
I think there's a lack of motivation.
Yeah.
You can't even get yourself out of bed. You can't get yourself to, you know, maybe even get dressed for the day. All of that, you just don't care. There's just this complete lack of motivation, which wasn't there before.
Right. And the last one on that list, there may be thoughts of death and dying. That may be present. There may be suicidal ideation. There may actually be suicide attempts, right? So I'm remembering that we have to meet quite a few criteria to get that. So we have to meet the criteria for the depression side of it and the criteria for the manic
side.
and the hypomanic phase. So what about a person who comes in and says, I'm a kind of a moody person? You know, sometimes at an intake, when you're asking someone to describe themselves, they'll say, well, I'm moody, I'm very sensitive, and I can go up and down fairly easily, you know. So again, the dialogue with the therapist is so important. You know, the therapist is going to be trying to find out and ask a lot of questions and try to understand what's happening with that individual. You know, if they've just lost their job or had a breakup, relationship breakup, etc., they might not be feeling that great. So we're looking for the sustained time here as well.
I think that's why it's important to really take your time diagnosing these things and not jump to the conclusions. And you have to look at, again, onset, what's the history, what's the duration of the symptoms, and how are the symptoms presenting. All of that has to be taken into consideration. And then you also, it's important after you talk to your therapist, if you and your therapist feel that you have that diagnosis, you need to see your medical doctor, and you need to see a psychiatrist just to have that next layer to make sure that they are also in agreement before they would recommend any medication. And the problem with sometimes with the medication is when you are bipolar, you often don't want to take your medication, especially if you tend to swing manic, because medication will bring you down. And even though the manic side can sometimes be destructive, they like the high of the mania, and the medication will knock them back and slow them down and even out the mood, and oftentimes they don't like the feeling of it, so they won't take it consistently, and then that brings on more manic episodes. And
we see that so much. You know, medical compliance. You know, when a person is compliant with it, it's such a difference, right? But what we see often is that things are going well. I've been doing great, you know, so I feel like I can perhaps just stop that. And then you see that start up again.
And that's why it's important, you know, sleep is so important, and stress. Those are big factors to trigger any kind of bipolar episode. And you can get off track with that much easier than you realize, especially if you somebody who works shift jobs. Your sleep is disturbed, or you're going on vacation and you're flying to Europe, and the first couple of days are kind of upside down. You get way off track on sleep, you get off track on maybe taking your meds, and that can prompt an episode.
Absolutely, yeah. And another question that often comes up is, what are the causes, right? And really, there's not just, excuse me, one cause. You know, genetics are something to consider. Someone who has family member with bipolar is at a lot higher likelihood to perhaps develop bipolar. But there's factors too that include the environment, you know, my own personality. So we're looking at a lot of different things, a lot of different factors. A good thing to do too for an individual who may not be sure, they're starting up therapy, not sure if they're what's going on with their moods, is to keep a mood log. That really helps the therapist too. You know, during the week, if you can track your moods, and we can start to see, sometimes when you track them on a daily basis, you start to see that there's really a pattern to this that I wouldn't have even thought of, but I see that it's fairly regular here, that this pattern. There is an app too, it's called Daylio, D-A-Y-L-I-O. Daylio is an app that you can have on your phone that is very good at tracking moods, just to keep a mood diary, or just writing it down. But as you said too, making an appointment, the next step is really sitting down, meeting with a psychiatrist who can prescribe the right meds. And the right meds will depend on whether, as we said earlier, is it bipolar 1, is it bipolar 2, is it cyclothymic? But there's a few different medications, and probably one of the most challenging things is to find the right medications. You know, not everyone's the same. In fact, everyone's a little different. So having the right mix and being patient with that, like it's almost like a trial and error sometimes, but when you find the right thing, there's an amazing difference in symptoms. So some of those meds that may include things like mood stabilizers that help control those extreme shifts, antipsychotic drugs, because there may be symptoms of psychosis. And that's one of those differentiations that we talked about between hypomania and mania. In mania, in a manic episode, a person may experience this psychosis, whereas you wouldn't see that in hypomania. So again, that's a consideration that the prescriber is going to look at. Antidepressants for the feelings of depression, anti-anxiety drugs that are going to reduce those feelings of, you know, anxiety, irritation, irritability, those kinds of things. And the communication that the client has with the prescriber is so important. I've often seen that, you know, the first person to figure out that there's something that's not working with the meds is the therapist. And you often, you know, you're working with your client and you have a good feeling for the client, and they've told you, you know, I've started these new meds, and then you notice at the next session or session further down the road, they seem really, really agitated or you noticing something, and you'll ask, you know, you compliant, and they'll say, yeah, and then you follow that question, and they may say, in fact, they often say, I didn't want to say anything to my prescriber. I didn't want to be difficult, you know. So as a therapist, you're kind of encouraging that dialogue, you know, make sure that you have a med-eval and you tell your doctor, write this down. If you get anxious and forgetful, write down some of the symptoms you're experiencing so they can adjust. And sometimes it's only a little adjustment, but that makes a difference.
And if your medication isn't agreeing with you and you're noticing that, and maybe you don't have a follow-up appointment for a few weeks out, call your provider and say, I need you to get in touch with me, my medication's not working. A lot of clients will just sit and suffer with it until they see the provider 6 weeks down the road, and that's just too long.
Yeah, it is.
You need to say, call me up. We may need to make an adjustment. We might even need to switch the med. And it's a little bit of trial and error, but if you get on the right med and you take it consistently, most people with bipolar disorder are very intelligent, very hardworking people, and they can have very successful jobs and very good lives if they're careful and manage their symptoms and take their meds and just be aware of triggering events like lack of sleep, stress levels. They can have a pretty normal, productive life without a lot of interruptions. It's when you get off track and you don't follow those things that your life goes like a roller coaster.
And one last thing I want to mention, non-medication, but for those individuals who have tried perhaps a whole lot of different meds for the depression side, there is something that's non-invasive. It's called TMS, Transcranial Magnetic Stimulation. It's a non-invasive form of brain stimulation where basically you're sitting, it's almost like a dentist chair, and you'll have magnetic stimulation above the head. It's like a pad that doesn't touch the head, it just goes a few inches above the head, and it generates a magnetic current that stimulates the area right underneath. So if it's for depression, it's normally on the left side of the front here, and there's a series of sessions. An individual will have to go every day for a few weeks, but this is in the case of someone who is so resistant to meds that they've tried, that there are certain people who are very responsive to this treatment. So it's something that they might want to try too. And also, at the bottom of this graphic, for anyone who's interested for themselves or a family member, I did put the link to a bipolar disorder ebook. And there's a lot of information in that too that you could download and look at. And again, thank you for joining us today. If you have any further questions about bipolar and symptoms, or if you have any suggestions of issues you'd like us to discuss, please contact us at phoenixinfo.online, or you can call 508-623-3931. Thank you.